Welcome back, everyone. I'm Emma. And today, we are going to talk about something that keeps adult children awake at night, the fear that their mom or dad will fall. I want to tell you a little bit about a man named Robert who was 78 years old, had Parkinson's disease, and was doing remarkably well at home. Still drove to the hardware store and still worked in his garage. His daughter called me one day and said, Emma, I'm not calling about anything. I don't think anything is wrong. And she was not calling, because anything was wrong, but because she wanted to plan ahead. She said, I know a fall is coming. I just don't know when, but I know one is coming because she sensed it. And 6 weeks later, Robert fell in his bathroom at 2 o'clock in the morning. He broke his hip. He spent 3 weeks between hospital and rehab. He never went back to the hardware store. He never worked in his garage again. Within a year, he was in a memory care unit. I tell you all that not to frighten you, but to be honest with you. Falls in older adults are not minor inconveniences. They are inflection points. They change the trajectories. And while we cannot prevent every fall, we can dramatically reduce the risk if we know what to look for. And so when a 30-year-old fall, or when a 30-year-old trips on a rug, they might bruise their knee. But the difference is when a 75-year-old trips on the same rug, they might break a hip. And the difference is not just bad luck, it's physiology. See, as we age, our bones become more brittle, our reflexes slow, our ability to catch ourselves diminishes. The medications that we are taking can affect balance and our blood pressure. Our vision changes, our perception, our sense of where our body is in space become less accurate. For someone with neurological conditions such as Parkinson's, stroke, or dementia, these risks amplified. See, Parkinson's affects gait and balance directly. Stroke can leave one side weaker, and dementia impairs judgment. So your mom or dad may not recognize that they can't do what they used to do before. And so that is one of the issues. And let me share with you some statistic that matters. Here's some statistic that matters. 1 in 3 adults over 65 falls every year, 1 in 3. And for those over 80, it's 1 in 2. And once someone has fallen, their risk of falling again doubles. Falls are not random events. They are predictable and they are often preventable. See, let's talk about the real cause of falls. When I do a home assessment or a home safety assessment, families often expect me to focus on throw rugs and grab bars. And yes, those matter. But the truth is, most falls have multiple contribution factors, and the environment is only one piece. One contribution factor that we can talk about is medication side effects. This is one of the hidden culprits. Blood pressure medications can cause dizziness. They can cause dizziness when standing. Sleep medications, sleep aids, can leave someone groggy at night. And when they get up to use the bathroom, they fall. Pain medications. Pain medication affects balance. And if your loved one is on is on 4 or more medications, that dramatically increase their risk for fall. So one of my recommendations is to ask your doctor or the pharmacist for give me a list of medication. Do a medication review, specifically focus on which one should I be worried about that put my mom at risk for fall. Which one? So do a medication review either with your doctor during one of your visits or with your pharmacist. I know sometimes it's not easy to find a pharmacist to do that, but at the doctor's office, when you do have a doctor's regular visit, just sit one of those questions, write them down, and to remember to ask. The other culprit is muscle weakness. After hospitalization, muscle become weak. Muscle loss happen very fast, especially in the legs. And your loved one, your mom, your dad, may feel fine sitting down, but when they try to stand up, their legs will give in. They're not as strong as they remember it used to be. And this mismatch between perception and reality is very dangerous. Okay. Vision problems, outdated glasses, cataracts, poor lighting. All of these contribute to falls. Bifocals are particularly risky on stairs because the lower portion distort depth. They distort depth perception. If your mom or dad hadn't had an eye exam recently, I would recommend that you would schedule one as soon as possible, just to review, to make sure that the vision issue is taken care of. Another culprit is footwear. I cannot tell you how many falls I have seen caused by slippers, socks without grips, or shoes that just don't fit properly. What feels comfortable is not always what is safe. And so supportive, non-slip footwear matters more than people really think or people realize. Here's another culprit. Rushing. Last year, 2025, the first part of 2025, I had 8 patients who came in with broken arms because they fell. You know why? Many fell because they were rushing. Many falls happen when someone is doing something in a hurry, hurry to answer the phone, to get to the bathroom, to respond to the doorbell. And so the urgency usually override the caution. They're not thinking. And so creating systems that reduce the need to rush can really prevent falls. And so it's not after the fall, but it's before. Create those kind of system and bringing it to the people, to their awareness. Talk about it, and bring it to awareness that reminds them about these things, because they're not thinking. Because at not times they're thinking, and that falls will happen. Now, let's talk about home modification. Home modification does matter. The home modification is the environment. It's where the person lives. I'm going to focus on the changes that have the biggest impact. I'm not going to give you the exhaustive checklist, but let's talk about some of the places that are important. Number one, bathroom. The bathroom. This is where most falls happen. The combination of wet surfaces, hard floors, and transitioning between sitting and standing make it a high risk in the bathroom. And so grab bars become very important. Real grab bars that anchors in the studs, not suction cups. So you would put them make sure that you have them near the toilet and also in the shower. Those places, that's very essential. Something else you look for in the bathroom is a shower chair, and a shower bench or a shower bench. Make sure if you have a shower chair or a shower bench that you also have extension shower cords, the shower hose that you can use to shower. Because sometimes I see people have a shower chair or a shower bench, but then the water's coming at them. So, and then if you have a caregiver, someone helping that person, they get all wet. So a shower chair, a shower bench, and make sure that you have handheld hose to be able to help. That's important. They need to stand on wet, slippery surfaces. I always tell my clients, soap, wet area, soap, and standing up in showers, weak legs, they don't work well in the shower. So a chair, a shower hose, sitting down, that really decreases the risk for fall. Another one is have a raised toilet seat. A raised toilet seat reduces the effort needed to stand. And so having that raised toilet seat in the bathroom, the shower chair, the shower bench, all of that, and not mixing soap, shower, surface, hard surface together, the very important, dramatically decrease the risk for fall, because falls will happen around these areas. The other area that we need to talk about is the bedroom. The bedroom nighttime falls are very common because people are groggy. I always tell people this, especially if you're taking blood pressure medication and sleeping, laying down, and then someone has to get up fast to go to the bathroom. Either they have to go to the bathroom, they have urgency, and so they get up fast and they get dizzy. The change in position, the change in the blood pressure quickly shift and make them weak and make them dizzy. And then now they're groggy. It's dark. Yeah, here it is. And usually they are rushing to the bathroom. And so that is a recipe for fall. So the other thing is you need a clear path from the bedroom to the bathroom. Okay, so to create a clear path, make sure you have a clear path from the bedroom to the bathroom. I also recommend that you have activated night lights for those people who have to rush to go to the bathroom, and also a bedside commode for those with the urgency, so you can significantly make a big difference in the decreasing the risk for fall. Okay. The other thing in the bedroom that look at is the position of the bed. A bed that's too high or too low will make transfer very hard. And when transfer is very hard because of the bed too high or too low, that will put that person at risk for fall. The next subject is stairs. If your loved one has any balance issues, stairs are serious. It's a serious concern. Make sure that you have handrails on both sides, good lighting, and contrasting tape on the edge of each step to improve visibility greatly help. But honestly, if there was a way to set up living on one floor for the older adult, that's the safest option. That's what I usually recommend for all older adults that they're not messing up with stairs. Okay. The other issue that will cause falls is clutter and cords. Anything on the floor is a tripping hazard. Extension cords, pet toys, newspapers, shoes by the door. You need a clear walking path to every room, from the kitchen to the bedroom, from the kitchen to the living room, bathroom, to the bedroom, to the front door. You need a clear walking pathway. Every room and every area is essential. This includes removing or securing throw rods. I know people love those throw rods, but they are responsible for countless falls. And so when I make an assessment into a safety assessment in a home and I see those, my recommendation is always get rid of them, because it's easier to get rid of them than to have to deal with a broken hip or falls. And believe me, they happen. I'm not just telling you that to get rid of your rugs, but I'm telling you that because they do cause falls. Now, beyond the home modifications that you could do that are very important, but they are not enough on their own. So far we talk about medication, we talk about the home modification. The most effective fall prevention that we can talk about is the combination of all of them. Environmental changes with physical conditioning is it make it is the solution or the recipe for for decreasing the risk of falls in the home. Strength training, strength exercises, particularly for the legs, can reduce fall risk by up to 40%. Okay, having the legs be stronger, doing exercise regularly. This doesn't mean going to the gym. It can be as simple as sitting and standing up from a chair 10 times twice a day. That's as easy as it is. Going from sitting to standing up from a chair 10 times a day. It can be gentle resistance exercises with an aide, with a caregiver, with a therapist. Now, that's one of the things that I add in my care plan for my caregivers. After they assist with activity of daily living, part of the plan of care is exercising the legs, because I know strength exercises is very important to prevent falls. The goal is to rebuild the muscles that has been lost. And so by doing that, balance exercises are equally important. See, recently, Tai Chi has been shown in multiple studies to reduce falls in older adults. So leg exercises, strengthening is very important. Even simple exercises such as standing up on one foot while holding a counter. Don't do it by yourself when nobody's home, but when you're with a caregiver, with someone in the home, try it. Heel to toe walking from down in the hallway can also can improve stability over time. And the key is to be consistent. The key is to do it all the time, because the body's changing. There's a physical the change. There's a physical changes, especially if you've been in the hospital recently. So with those weak muscles, you're in the hospital, you're in bed all the time, you are secluded. Now that you're at home, yeah, those leg exercises become extremely important, so you can rebuild muscle strength again. There's also a psychological component also. After a fall, or even after a near fall, many older adults become very afraid. They become scared. They don't want to move. They stop doing things that they used to do before because they are afraid they're going to fall again. And so that's understandable, but it also creates a vicious cycle. Less movement leads to more weakness, which leads to higher risk of fall. So rebuilding confidence gradually and safely is part of the prevention. So we know that, and so that's one of the things that we focus on. So in closing, I think about Robert often. I think about what might have been different if we had acted on her daughter's instinct 6 weeks earlier. If we had done the medication review, if we had done all these things for him, modifying the bathroom, the bedrooms and all that, start the strength exercises before the fall instead of after. And so that is why I'm doing this this webinar today, or this live, to talk about this, to bring more awareness about falls and how we can prevent them. You cannot prevent every fall. Some will happen despite everything that you do, but you can shift the odds. You can create an environment and a body that are more forgiving, more resilient, and more prepared. And so if you are worried about your mom or dad falling, that worry is information. It's telling you something, just like my Robert's daughter. Don't wait for the fall to happen, but act on it. Act on it. Give us a call if you are concerned, if you have anything in your mind, you notice something that you want to talk about in regards to fall. There are no wrong questions. There are no stupid questions. Just reach out to us. We'll talk through it. Any of your concerns, we'll give you some guidance. We'll give you some advice, some recommendation of things, because we've seen them all. Okay. So let's go over some questions. Some things that, I hear often from caregivers, family caregivers. My parents always, my parents, my mom or dad already fell once. Does that mean they are going to fall again? Good question. Previous fall does increase the risk of another fall, but it doesn't make it inevitable. What does is give you, what it does, it gives you valuable information. Number one, what caused the fall? Was it environment? Was it medical? Was it physical? Or was it all of them, all of the above? Use the fall as a catalyst to get a complete assessment. That's one of the reasons that you need to call us. If your mom or dad had a fall or anything, give us a call. We'll do a home safety assessment, and we'll figure out what caused the fall. We'll build preventable prevention. How can we prevent them from doing another one? Many people fall once and then they make changes and they don't fall again for years. Okay. So if that happened, this is one of the things that you are concerns you today. Give us a call. We'll create a plan for you. That's what I mean by creating a system ahead of time so you can prevent these things happening. Okay. Another question. They refuse to use walker. They refuse to use a walker. What can I do? This is so common. See, walkers feel like a symbol of decline, and many people resist them fiercely. And here's my approach to this. Have the recommendation come from a professional. Have the recommendation come from us. Because see, we don't just throw a walker at them. We give them the reason, we give them education behind it. Because when people understand the reason behind things, they are more apt to do it. Let the recommendation come from a doctor. Let the recommendation come from a physical therapist, not from not from the daughter, the son. Sometimes that carries more, sometimes when they hear it from us, it carries more weight. So that's one of my recommendations. The other thing is start with a cane. If they'll accept that, focus on what the walker allows them to do, not what it represents. And sometimes, unfortunately, it takes a fall. It takes a fall for someone to accept help. I'm sorry to tell you that, but it does happen. Okay. Another question is, should I get one of those medical alert buttons? Should I get one of those medical alert buttons? Here's what I have to say about that. Medical alert systems can be valuable, not because they prevent falls, but because they ensure help comes quickly if a fall happens. The key is that your loved one has to actually wear it and be willing to use it. And many people leave them in the drawer or they take them off at night, which is exactly when falls happen. That is why we introduced Sensi in the home. Sensi is a new technology that we place in our clients' homes, whether you're a client or not, if that's all you need. And usually when I do a home assessment, safety assessment, I would recommend Sensi. It's just to prevent things like that. Sensi, which is a technology in the home that we place in the home, it helps us to not only prevent falls, urinary tract infections. It tells us alert us about the signs of respiratory infections. Those are all the things when we can catch them early, they can prevent falls. And so even they don't have to wear anything. So when they get up at night, they fall in the bathroom, then it does alert us. Just in case they didn't wear their button, they didn't wear their necklace with them. So that's the one way of getting around it, because it will alert us when the person falls. It will alert us if they see, if the technology notice a change in behavior, such as they going to the bathroom more often, they coughing more often. Those are the three things that we pick a lot: upper respiratory infection, urinary tract infection, and prevent falls. So that if this is the only reason you need to reach out to us, call us and ask us about Sensi. How the other one that I hear is, how do I convince them that their home is not safe anymore? This is one of the hardest conversations in elder care. How would we frame it? The goal is that to convince them that their home is unsafe, but to make their home safer. Most people can stay in their homes longer with the right modification and the right support. All of these things that I just covered today, with the one assessment, if we can identify them, number one, medication. Okay. Number two, the home modification. Number three, the body, the physical strengthening, the exercises, looking at the reason for falls and examine and give recommendations, set up system. All of a sudden, you change, you decrease the risk dramatically for fall. And so that would allow the person to remain in their home. Start with changes they will accept. Bring us. That's the first step. Bring us as a professional to do an assessment. Sometimes an outside voice is heard is differently than yours. And be patient. This is about their independence. This is about their independence, their identity. And so they deserve time, they deserve the respect to be able to make that kind of decision. So in closing, I want to thank you. Thank you for being here today. If you like to talk through your specific situation, whether that's a recent fall, a near miss, just you have a concern, you have an intuition, something is bothering you, you see how mom is moving, their balance, and you don't want them to fall, I'm happy to help you think through the next step. Give us a call, 704-209-5040. Just send an email, info@Gentle Shepherd Care. Check our website, gentleshepherdcare.com. And so we are here every Wednesday at noon. If you find that this information has been helpful, share it with someone who might need it. Keep it, save it, that you can review again.